primary parturient care, okay? And what this means is during the birth process, around the birth process, when we're looking at animals, we have to look at what kind of animals. Are they altricial or are they precocial? Altricial means again, their eyes are closed, they're completely helpless, they can't do anything by themselves. Precocial means, man, they hit the ground running, like guinea pigs or foals and calves. Okay? Completely different when it comes to the care afterwards. Natural birth depends on how well it went as to what kind of care you have to give. If it went really well, mom might be just jumping around acting pretty normal. The neonates might be really good as long as the natural birth process was normal. If it was not normal, then this is going to change. If there was dystocia of any sort, and it was hard to get the puppies or the kittens out, this is going to change. If it's a C-section, it really changes because the mom's under anesthesia. Puppies are coming out. And when I'm doing a C-section, I don't care about the puppies. I got to worry about the surgeon. That means when the puppies or kittens come out, guess where they go? Into your hands. You're going to have a towel. I'm going to put the puppy up here like this, and I'm going to drop it into your hands with the towel. Because I can't touch you. So I'm just going to drop it. That means you have to take care of everything from that point forward to make sure that puppy stays alive. Okay? That's your job, because I'm worried about mom. Now, when it comes to C-sections and immediate postnatal, when I pass puppies off, they are either still attached to a placenta or they're wrapped in a membrane. And I'm just going to give them to you. Well, that means you got to take care of all that stuff. If there are fetal membranes, the sac that the puppy is in or the offspring is in, you got to get it off of there. Because as long as it's on there, they can't breathe. Okay? So you got to get that off. Then you have to stimulate them. You're going to dry the heck out of them. Remember what they used to do in babies that were first born? Spank them on the butt. Why? To get them to breathe. Because if they cry, they're breathing. One that doesn't make any noise, you have no idea what's going on. Okay? If they vocalize really quickly, their survival association goes up. Okay? At least to a week. So that means while you're stimulating them, if you can make them make a noise on their own, their chances for survival go up. Okay? The other thing, this infant or this offspring has been living inside a fluid environment for the last 2 months. What's it been breathing?
Fluid.
Nothing. But fluid's been going in and out of what are its lungs. The oxygen comes from where? Umbilicus. Okay? But you got to get those fluids out of the lungs, because if there's fluid in the lung, then air can't get in, so now they can't breathe. So what we use is a bulb syringe. And you put it in the mouth, you put it up each nostril, and you suck out anything that's in there. Years ago, we used to do what's called a centrifugal swing, where you put the puppy or kitten in your hands, you support the head, and you do this.
Yeah.
So all the fluid would come out. And it works really well. As long as you're doing what you're supposed to do, and you don't do it so much that you cause vessels in the brain to break, cause cerebral hemorrhage. Okay? So not many people do this anymore. They should be doing this.
We used to do it with the pigs.
Huh?
We used to do it with the pigs.
Do what?
The
Centrifugal swing? That's because it was taught a long time ago, and it works. I've done it many times. But how many times when the puppy didn't survive, or a kitten didn't survive, or a piglet didn't survive, did they not survive because they had cerebral hemorrhage that you didn't know about? Because you caused it. Okay? It's one of the reasons why this is becoming a little on the controversial side. If they're starting to breathe, but they're not quite doing right, then give them some oxygen. Well, how are you going to give a puppy or a kitten that's this big positive pressure ventilation? You're gonna put their mouth in your mouth and you're gonna blow. Mouth to nose, because what's inside your dead space? Room oxygen, which is how much?
20%.
About 20% oxygen. So you're giving them some oxygen. The other thing you can do is the Jen Chung acupuncture point. And that is right here. And you're gonna take a tiny little needle, you're gonna stick it right in there, you're gonna twirl it around. That will stimulate the respiratory centers, okay? Drugs can be used. The analeptic drug that we would potentially use is doxapram. However, does it really work? Well, dead or doxapram? To me, it's a pretty easy choice. Because doxapram doesn't just stimulate the respiratory center. Doxapram stimulates the entire central nervous system. So other things could happen, okay? But if I had to choose dead or doxapram, I'd use doxapram. And 1 or 2 drops under the tongue is all you need. You don't give it an injection, you don't do anything, you just put a drop under the tongue.
Is that why they say that, doxapram, like the brand name?
Dopram.
Right? Is that why they say that it can cause seizures?
Yes.
Because it stimulates the whole seizure?
Exactly. Okay? Now, the other thing we gotta deal with, even if the placenta doesn't come with the offspring, it's still gonna have an umbilicus attached to it. As the person doing the C-section, what I would probably do is take a pair of hemostats, clamp off the umbilical cord between the puppy and the placenta, because sometimes the placenta doesn't come out, okay? I'd take the 2 hemostats, I'd cut between them, and drop the puppy with a hemostat into your towel. And then you gotta deal with it. The best way to deal with that is you get some absorbable suture material, like gut or monocryl, and you have to ligate it, which means you guys have to know how to tie a ligature. And then the other thing that can be done is you put a little bit of iodine on the tip of it. Okay, and that's really important when it comes to things like horses. Then you gotta get them warm, okay? You gotta dry them and rub them, and then get them up to about 86 to 90 degrees. So once they're dry and they're making noise and whatever, put them in an incubator or a box that has a heater pad under part of it and up the side wall part of it. That means if they get too hot, they can crawl off. They can crawl back on, okay? Unless you have an incubator, then just put them in the incubator. Set at a certain temperature. If they need oxygen, they're not responding very well, again, and if it's after the fact and you're not gonna breathe in their nose all the time, you can get tiny little cones to go over their nose and just give them oxygen, okay? Glucose, for those that are still not doing what they're supposed to, they may need some energy substrate. So, poorly responsive ones, just get some glucose, some dextrose out of the bottle, and put it on their tongue. What's another thing you could do? Carob syrup, and put it on their tongue, and it'll absorb and they'll get some glucose. Then you want to get that puppy back with mom as fast as possible, which means what? Mom has to be what? Which means she can't be under anesthesia anymore. She has to be awake, and awake enough so that when the puppies come in there, she's not going to tear them apart or ignore them. She has to be fully conscious. Until that time, you have to do everything. Okay? Now, once that animal is born and it's in its incubator or whatever, and you have time, because now you don't have 14 of them to take care of. That was my first C-section, by the way, it was 14 puppies. Okay, you should have seen the staff trying to deal with 14 puppies. You gotta do a physical exam, okay? Physical exams are really important. Their body temperature is normally 96 to 97 for the whole first week, okay? Then it starts to come up, okay? Now they're starting to have some means of controlling their body temperature. Well, that means the thermoregulatory center in the brain is now becoming more mature. It can affect the liver metabolism, okay? So it takes a while. Respiratory rate is about 8 to 18 per minute on the first day. But then it slows down after that because the hemoglobin starts to change from fetal hemoglobin to adult hemoglobin. Heart rates, 120 to 150 beats per minute on the first day, and then it's going to change according to their size. All of this stuff gives you something called a score. In humans, they call it APGAR. If you've ever seen or heard of APGAR scores, it's a score that you use with these parameters to give you an idea of what kind of shape the animal is in, or in human cases, the baby. So they're going to look at heart rate. If it's less than this, you get 0, more, you get more points. Okay, and you do that with every one of those things. And then you add up the points. If the points are 7 to 10, puppy's in great shape. If the score is 4 to 6, there's something going on. And then if it's really low, that animal is very likely going to die unless you do something very quickly. Okay? So again, this is for dogs and cats, and it's a modification of APGAR. Okay? You guys, if you deal with doing C-sections and puppies and kittens, you need to know this. You should have that posted on a wall somewhere so that you can find out what the score is and then determine, do I need to do something with this puppy or this puppy? Okay? Now, when you do your physical exam, you're going to do the same thing you do with others. You're going to look at mucous membranes and capillary refill time. Fortunately, even in newborns, it should be pale pink, less than 2 seconds. Body weight, obviously in puppies, the Chihuahua is not going to weigh the same as a St. Bernard puppy. So there's a big variation in puppies. But when it comes to kittens, normal kittens, they should be somewhere between 80 and 140 grams when they're born. Which means what? You have to have a scale that measures in grams, not just pounds. So every clinic that does this stuff should have a gram scale set aside specifically for this purpose. Okay? Then you're going to start looking at the body systems. First thing, obviously, head, oral cavity area. One of the things you're looking for is something like this or this. This is a cleft palate. This is a cleft palate and cleft lip. Okay? Anybody know what the problems with those are?
They can't suck.
Why?
There's no suction.
They can't create a seal around it, so they cannot draw fluids in. So these two animals here have to be tube fed until such time as the owners will allow surgery to try to fix them. Okay? That's kind of expensive.
What happens if we don't fix them? They're done.
They can die. They'll get aspiration pneumonia, or they'll starve to death. I've seen some people keep tube feeding them, saying, I'm not going to do surgery. Okay, so they tube feed them until they're able to wean them. Now what? When they eat?
So that's good.
It goes right up into the nasal cavity. They start getting sinusitis. There's a good chance it's going to go down the lungs. So then they're going to get aspiration pneumonia and nasal problems.
So with that being said, do you think it's humane that at birth, if the owners say that they don't have the means to care for cleft palate or cleft lip, that euthanasia is an option?
Absolutely, without question. Because the other alternative is misery.
Right.
Okay? So if the owner sees this and says, I just can't afford to do anything with that, put them down. Okay? Don't make them go through what they're going to potentially go through. Ears are usually closed up until 6 to 14 days. So when you look underneath the ear flaps, it's sealed. It's completely sealed shut. And it won't start to open up where you can see ear canals until they're about a week or two old. Eyes, the eyes aren't open in these altricial young. Okay? You can look there and you're going to see, but the lids don't even separate until about a week out. And that means it's starting to open up a little bit. Okay? If you have eyes that are open and you shine a light in it, you may not see a pupillary light response because they may not be mature enough for that nerve connection to make contact. Okay? The thorax, there should be a sinus rhythm in these young animals. There shouldn't be any sinus arrhythmia yet. There might be still a murmur though. If you listen to a brand new born, you still might hear a murmur. Why?
The shunt from the mom to the
Where is the shunt? In the heart. There is a shunt between the left side of the heart and the right side of the heart. In young animals, when they're born and they start breathing, that usually closes down. If it doesn't close down, you hear a washing machine type sound. Okay? But if you listen the next day, it may be gone. Okay? That means it's closed. But you have to continue to listen. Lung sounds, when you listen to the lungs, if they're breathing okay, it should sound the same on both sides. Okay? There shouldn't be a really dull, hardly any sound on one side and sounds on the other. That could mean there's a lung problem. You're going to look at the abdomen. You're going to palpate the abdomen. Make sure it's not really big and bloated. Make sure that when you palpate, you can feel things in there, like two little tiny pea-shaped size things. It might be the kidneys. And that's really easy in kittens to feel. Stomach, they've been living where for the last 2 months? Inside fluid. What's inside the GI tract? Fluid. So, the stomach should be fluid filled, but their abdomen shouldn't be massive like that. Okay? The skin, you're going to look at the hair coat. You're going to look for any potential problems that might indicate a genetic problem. Genetics are going to change things. For example, if this was a Siamese cat, what color would it be?
White.
White. Completely white. It doesn't have gray tips on it yet. That's temperature dependent. Okay? And then also, if it's a calico, what else do I know? It's a female. Unless it's a weird calico. Because calico cats are females. Okay? So it tells you a lot by looking at the hair color. Also, you want to find out, is it completely there? What can you tell me about this kitten right here? Just by looking at the hair coat. She's not maybe, she is premature. Because there's no hair yet. There's no hair across here. There's no hair under here. The hair hasn't grown in yet. So the hair coat can tell you maturity level. Hydration status, you're going to look at mucous membranes. You can kind of pick up the skin, see what's going on, look for wounds, look for parasites, especially if it's born to an animal that has fleas. Because as soon as they're born and they're back with mom, they're going to get fleas. Okay? You're going to look at the umbilicus for signs of inflammation. Hopefully you've already tied it off, maybe dipped it in iodine. But normally what happens to that umbilicus over time is it dies. The vessels on the inside collapse down, so that means there's no blood supply going to the umbilical remnant that you tied off. That means it's going to turn black and eventually fall off. Well, that's through the inflammatory process, right there at the point of attachment. Okay? So you have to start watching for that. Then you got to look at the extremities. Look at all the limbs. Make sure that they're correct. I had one dog, it actually went to, what's that museum that does all sorts of weird stuff?
Yes.
What was the name of that? Ripley's Believe It or Not or something, remember?
Yeah.
One of my dog puppies went to that. When I was doing practice in Henderson, did a C-section, puppy came out with 5 legs. Well, it went to Ripley's Believe It or Not, but because the owner wasn't paying attention, they were more interested in their pocketbook than the puppy's life, they didn't vaccinate it, and it died of parvo. So they sold the carcass to Ripley's Believe It or Not, and it's somewhere, a little puppy with 5 legs. They wouldn't let me take the leg off to make it so it was okay. When you look at the other parts of the body system, you have to look at the anus. You have to make sure that it's open. Okay? Here's an anus. There's no hole. That's a problem. Okay? That's an imperforate anus, which means what?
Can't move.
Where does it go?
Nowhere.
It stays in there and it starts to fill up.
So what, you just
Okay.
cut your own?
Have to make one. Okay? You have to looking for inflammation. The other thing is you have to look at the genitals. Everybody see what's going on here?
Can't tell.
That's the penis. That's the prepuce and penis. The opening for the urethra is not at the end of the penis. It's in the middle. Okay? That's a problem. So you have to look for that kind of stuff. It doesn't always end up where it's supposed to. That's even in humans. So when this dog urinates, it's gonna come out over here, not at the end of the penis where it's supposed to. It just dribbles on the floor. Then you have to look at the nervous system. One of the things is when they're born, they have a reflex. You stick something in their mouth and touch the roof of the mouth, they start to suck. Okay? That usually lasts for about 3 weeks. And then it becomes a learned thing, not a reflexive thing. So if you put a little thing inside the mouth, they should suck on it, like the nipple of a bottle. If they don't, there's a problem with the nervous system. Okay? Now, you also have to look at the history of mom when you're looking at the offspring. Remember, mom creates colostrum. What's in the colostrum? Antibodies, the passive immunity. So if mom's not been vaccinated, puppies may not have the immunity they need. Okay? If mom's really malnourished, what do you think the puppy's response or condition's going to be? They're not going to be very good either. You have to look for all of this stuff and then watch mom, because you can't put mom and offspring back together unless mom's in good shape. The litter mates, you want to know how many they are. And then what's the health of those litter mates when you're doing your exam on these puppies and kittens. How many will dictate what?
How much milk?
How much nutrition they might get. How much nutrition do you think those 14 puppies I delivered by C-section were getting? Because mom only had a certain number of faucets. And if they didn't get in there to get to a faucet, they didn't get any nutrition. Okay? The individual, how is it raised? If it's a orphan and it's taken someplace, how are they raising it? Have there been any problems with the mom or the offspring? Because that's going to affect what happens down the road. So, when you're doing your physical exam, they need to be in a warm environment, especially if they're neonates, because they have to be kept at a certain temperature. You got to use the right equipment. How many think your stethoscopes that you have, you can listen to a puppy or kitten that's this big? Not unless you have a pediatric stethoscope. The bell is too big or the diaphragm is too big around. You need to have the smaller one. Okay? So that's one of the reasons why having one of each might be helpful. Temperature, yeah, you need to have an electronic temperature, but you want to have one that's for veterinary because it has the ability to go a lot lower. Because what's the temperature of these animals when they are neonates? Really low. Okay? If your temperature, the thermometer doesn't go that low, then you don't know what the temperature is. The weight is really important because weight is a survival indicator. So that means you need to know what the birth weight is. And then you're going to monitor it up to 7 to 10 days to see what's happening. Normally, when a baby is born, as soon as they're born, they lose weight because there's a lot of fluid weight that's gone and everything. So they usually lose it about 10% in the first 24 hours. If they continue to lose and don't gain weight, that animal's in trouble. Okay? The expected gains, what you would expect a puppy or a kitten to gain, in puppies, 1 to 2 grams per day for every 454 grams of anticipated body weight. Okay? So, anticipated adult weight, let's say it's a beagle, and you anticipate the adult weight to be 20 pounds. Okay? How much weight should the puppy gain every day if the expected body weight's 20 pounds? What's 454 grams? How much is that? Because I gave you the weight to you in pounds. Right? Said the dog's going to be 20 pounds.
So it needs to gain, yeah, you said 20 pounds?
Yeah, but how much is this?
Oh, I just did 20 pounds in grams. I went that way. I did 20 pounds in grams.
How much is
divided by
this?
40.
No, just, you You guys know this, you should know this.
I don't. That's almost,
That's 1 pound.
per pound.
454 grams is 1
What?
pound.
Yeah.
Okay? So, 1 to 2 grams per day per 1 pound of anticipated body weight. Okay? So how much does it need to gain a day?
20 to 40 grams.
Everybody get it? Is she right? Anybody do the math to check her?
That's 1 pound and it weighs 20 pounds. So
That's the anticipated adult body weight.
1 to 2 grams per day.
So is she right?
Yeah.
You're sure?
I'm not sure anymore.
I just want you to be sure.
I'm sure.
Okay. So that's how much they should be gaining. A beagle puppy that you anticipate its adult weight to be 20 pounds should be gaining 10 to 20 grams or 20 to 40 grams for that puppy every single day. Well, how much is 20 grams?
That's a paper clips.
Okay, if you're using little paper clips, okay? A pound of butter, 20 to 40 grams. So you're looking at 1/10 of a pound, basically, right? 1/10 of a pound per day they should be gaining. Everybody see how that works? If it's a kitten, we can't go based on this because there's not such a variability in body size. So kittens should be gaining 50 to 100 grams per week. If they're not gaining weight after their initial loss, there's a problem. So the best way to tell if they're doing okay is make sure you weigh them. Now, when it comes to thermal regulation, remember we said that when puppies are first born, their brain, their thermal regulatory center isn't set right. And it doesn't set for about 6 days. So they can't shiver. Their vessels don't constrict on the periphery if they get cold. They just lay there, okay? Once their thermal regulatory center kicks in, now when they get cold, you can see them to start to shiver, okay? Or their mucous membranes may get pale because they're vasoconstricted. Rectal temperature should be 95 to 99 degrees Fahrenheit, okay? They can do okay at that temperature. Their external heat source during this time period then should be high, should be a lot warmer than what an air-conditioned house would be. First 5 days up to 90 degrees, second about 80, and then the last, after 20 days, they can get it down to room temperature, and they can usually do okay. When it comes to anemias or blood cell counts, okay? During the first 4 to 6 weeks, they have a physiologic anemia. That means low red blood cells. Because the plasma volume is high, red blood cells are low, and red blood cells at this time have a very short lifespan. Because it's a different kind of red blood cell because of the hemoglobin that's in there. They don't start having adult values for their red blood cell count until they hit about 3 months of age. If you look at the hemogram, the parameters are also less, okay? And when we talk about the hemogram, we're looking at things like white blood cell counts, the number of neutrophils, lymphocytes, things like that. They're all going to be less. Well, here's a chart that kind of gives what they should be normally, if at those specific ages. When you're looking at chemistries, puppies and kittens have invariably a high alkaline phosphatase and increased phosphorus. That's just normal in young animals. But albumin is low, usually. The globulins are low, especially if they have a nurse. Cholesterol and BUN are low. This is a reflection of what's going on with the organs. The liver is not fully functional yet. And that's, globulins come from the immune system, so if the colostrum is gone, there's not going to be any globulins in there. Cholesterol goes back to liver. It's not doing its job yet. BUN is going to be different because BUN has to do with liver and kidneys, okay? Urine-specific gravity is going to be low in puppies and kittens. Why? Because the kidneys aren't working fully yet. They're not fully developed. Glucose is probably going to be increased. because it's not keeping the glucose back and we're putting it in storage. Where? Where's glucose stored? Huh? You guys have this. In the liver as glucagon. Okay? And it's not functioning yet. Renal function, again, glomerular filtration rate is low because they're not doing their job. Concentration or urine-specific gravity is low, and there might be imbalances because they haven't got that system figured out yet where fluids will transverse membranes and to equalize each other yet. Anybody have questions about that stuff? All right, so now when do we start doing anything about these? Well, that means they have to bring them in. There's got to be a veterinary visit. Now, if it's a C-section, obviously that's going to be while they're there. If they're natural birth, they really should come in and see the vet somewhere between birth and 12 weeks. 12 weeks or 3 months, they're a little behind on vaccines already. Okay? You got to make sure there's not a congenital problem, something they were born with. Nutritional, if they're not gaining weight, you should be able to detect that. If they were really the runt of the litter, that could be a problem. If they've had trauma, I've seen a lot of puppies where mom tried to chew the umbilicus off, got a little close and took away some of the skin. Can mom create an umbilical hernia? No, doesn't happen. Umbilical hernias are congenital defects, generally hereditary. Okay? If mom is going that far, she's taking out intestines and stuff with it. Okay? Neonatal isoerythrolysis, you guys learned about that. When would you see that in a puppy or a kitten?
Yeah, they're different, like abort and mom.
When dad had, or what type of mom, and now they made a baby, that's.
If you have colostrum from the mother, it attacks the red blood cells of the offspring. That means the mother, if it was a dog, had to have a pre-transfusion. Okay? If it's a cat, it doesn't matter because now it has to do with autoantibodies. Okay? And then infectious diseases, especially if they didn't get any colostrum from mom and then they got exposed at this age period because now their immune system doesn't work and they don't have antibodies in the blood to fight the infection. Orphaned animals really need to come in early because most people out there don't know how to deal with these guys. So you got to see them so you can train them. Mortality at this age, 0 to 4 weeks, is somewhere between 9 and 20%, 26%. So that means up to 1/4 of the puppies and kittens born within 4 weeks are dead. Okay? Well, a lot of this has to do with what's gone on here and what the owners are doing. It's a lot higher during the first week. So if between 0 and 4 weeks it's 25%, well, during the first week it might be 40%. It all depends on what's going on. If there is a compromised immune system, well, that could be a couple of reasons. During the first days of their life, it's not even developed properly. It can't respond yet. That's why they need to have the colostrum. They don't even get absorption of colostrum, though, after 1 day. If they're born and then they don't nurse for 24 hours, the chances of them getting any antibodies from it are almost 0. Because the ability to absorb the proteins, the globulins from the mother, goes away from their intestines after 1 day, maybe 36 hours, okay? So they gotta nurse. They have to get onto mom so they can get some of that colostrum. If they don't, there's a good chance that they're going to be compromised and could get an infectious disease. Well, if they don't nurse, we have alternatives. We can give them plasma therapy. We can give them plasma, adult serum, 150 mils per kilogram sub-Q or intraperitoneal. That means you're going to take an animal that's got immunity, it's vaccinated, you're going to take a blood sample, you're going to spin it down and separate the plasma from the red blood cells, then you're going to give the plasma to the kitten. Okay? Just don't give them from the dam because of the possibility of neonatal isoerythrolysis. Get it from another cat. okay? Puppies, adult serum, 40 mils per kilogram orally, or you can give it sub-Q or IP, but not from the dam, because you don't want potential problems. Now, one of the big health problems in puppies and kittens is septicemia, or they get infection someplace and then it starts to go throughout the body. And that's a real problem. Maybe it's because the umbilicus wasn't tied off or taken care of properly, or mom started licking and chewing at it and made it infected because of the stuff that's in her mouth. It's one of the reasons why we use iodine and dip the end of the umbilicus to hopefully kill anything that might be ascending up into the umbilicus, okay? Prolonged delivery. If they've had dystocia, it takes a long time for them to get out, there's a possibility of more problems. Milk replacers. Using milk replacers in puppies and kittens is not ideal. Usually we give it to them because they're in poor health or they didn't nurse or we're having to tube feed them. But what we find out is they don't do very well. They might even get aspiration, especially if they're being tube fed and somebody puts the tube down into the lungs and fills the lungs up with food. That's a problem. A lot of people that don't know how to do it cause problems. So guess what you guys have to be able to do? Tube feed puppies and kittens, okay? Using ampicillin in puppies and kittens when they're really young increases the potential that the bacteria you're trying to kill become resistant to ampicillin. So then what do? You gotta use another antibiotic, and then they get resistant to that. They have found out that in puppies and kittens, if this is used, they usually have more problems, even septicemia, because now ampicillin can't kill the bacteria. If there's a lot of stress, if they're born and they're the runts of the litter, or if they get cold, any of these factors can increase the potential for them to get an infection, which could advance to septicemia. Clinical signs of septicemia, they're low birth weights, or not birth weights, but they don't gain any weight. They don't nurse. You might see hematuria, blood or red color in the urine, diarrhea, abnormal crying, okay, that means they're constantly crying or they don't make any noise at all. Another real good sign is a distended abdomen like that. This animal definitely is septicemia, okay? Not just because of the abdomen, but look at that tongue, okay? That's not the right color. And I've even seen some of them, when they get that bad, their limbs die and limbs fall off, okay? And then sometimes they just die, okay? You can see this puppy's limbs here. What's this color versus this color? This is cyanotic. This limb is dead, okay? Because of septicemia. Now, another potential problem is herpes virus. If a naive female is exposed to herpes virus during the last 3 weeks, they may not be able to build antibodies to herpes virus. May not be fast enough. So that means there's no colostrum that has immunity against herpes virus. The results for herpes virus is the offspring are going to die and she'll abort them, or when they are born, they might be there for a while, but then they're going to die. Almost invariably. I've never seen an animal that had that survived. Okay? Now, when it comes to nutrition for these guys, remember, their body temperature is low, their thermoregulatory center isn't set, and they don't have any fat reserves because they're just living off the nutrition that comes through the umbilicus, okay? They don't have any ability to generate any glucose because their liver doesn't have any glucagon stored up, which is broken down into glucose. So nutrition is a big deal for these neonates. They're always dependent upon mom. Well, what if mom says, to heck with you? They're probably going to die. If the litter's too big, like 14 puppies and only 6 faucets or 8 faucets, okay, that's a problem. And then sometimes mom doesn't produce any milk or enough milk because there's something wrong with her. So that means the offspring are usually going to be weak. There might be congenital abnormalities. They can't get up and nurse, or they could be sick. any of those conditions are going to really result in nutritional problems, okay? Malnutrition signs include the runt. Those two dogs, puppies, are from the same litter, okay? Doesn't mean that they have the same dad, but they're from the same litter, okay? Weak, unable to nurse, they're inactive, maybe constantly crying or not doing anything, just laying over off to the side. And they're generally quite cold, okay? Any of those signs, you can look at malnutrition. Fading syndrome means that they're normal at birth, okay? They might be a little on the low side, but then all of a sudden, they're not doing anything. They start going downhill, usually during that first 4 weeks of life, with the first few days the biggest concern. Another concern that you see in puppies and kittens is something, and puppies more often, is this thing called ophthalmia neonatorum. And ophthalmia neonatorum is when they get what's called purulent conjunctivitis. That means pus in the conjunctival area. So you see a puppy like this, one eye's normal, one eye's really big, okay? And that just means there's pus behind that. Sometimes it's both eyes. Well, to get rid of it, you gotta open the eyelids prematurely, and then pus runs all over the place. If you don't do it fast enough, the eye might be damaged permanently. Now, when it comes to getting these guys to nurse, first off, you gotta get them warm. You don't wanna put them in a microwave, okay, and warm them up fast. You don't wanna put them in high temperature, you gotta go do slowly, okay? You don't wanna cause problems. Fluid replacement for them can be intravenous. If it's a big enough puppy, there's no way you're gonna get a vein in a little kitten. But a big St. Bernard puppy, yeah, you might find a vein. Intraosseous can work, oral or sub-Q. If you're going to use antibiotics in these animals because they might be septicemic, you need to use a broad spectrum cidal. What does cidal mean? It kills the organisms. One of the best ones out there is Naxel, or ceftiofur. It works really well, it's cidal, and it usually takes care of all organisms. How much? Well, remember, they're not mature enough yet, so you have to decrease the dose by 30 to 50% of what you would normally give. Well, how do you figure out what a dose is?
Doctor.
No. You gotta know the dosage. The dosage is what the doctor gives you. You calculate the dose from the dosage. And? The dosage and?
Concentration.
Huh?
Concentration. Weight.
Body weight. That's how you calculate dose. Dosage times body weight equals dose. Okay? If it's a lactating female, some people will give the lactating female the antibiotic and think that it will cross into the milk. Well, it might, but you don't know how much is crossing over. So giving the mom antibiotics to hopefully get it into the puppies or kittens doesn't work very well. If we're gonna give glucose, okay, remember, we're doing these tests to a sick puppy or kitten, we gotta get that glucose into them quickly. They have 2 to 4 times the requirement of glucose in adults do because they don't have the ability to create or store anything yet. So if they get hypoglycemic, they can start having real problems. So you gotta get on this. Normothermic animals that are properly hydrated, give them 20% glucose, and you can give that 0.25 mils for every 25 grams of body weight, okay? Or put it under the tongue, and then start letting it absorb. Intravenous or IO, you can give a little bit more per kilogram, but you gotta go slow. And it has to be IV, because if it goes subcutaneous, not only is it gonna be uncomfortable, but now you've created a perfect environment for bacteria. It's dark, it's warm, and it's got plenty of sugar. And bacteria love that. Vitamin K is another thing that might be a problem in some of these neonates, okay? And the problem is without vitamin K, they can't have the good clotting factors. So, some people just give vitamin K supplements to these. That's okay as long as they don't have reactions to it. So orphans now. Orphans, if we have an orphan, one of the best options to find is a lactating female that will take them. And let you off the hook. Because if you're on the hook, you're gonna be busy for a long time, and you're gonna lose sleep, okay? So it's best to let a lactating female. I've seen kittens grafted onto dogs, other dogs, and they take care of them. I've seen puppies onto cats, and they nurse, okay? If you do a hand feeding, time consuming for up to a month and a half, you're gonna have to be doing this stuff, okay? And you have to do it when they require it. And it's not like you and me, that we can get by for eating one meal a day. Well, some of us can. But you can't do that with them. You have to feed them more often on a regular basis. They have to be warm. If they're not at proper body temperature, whatever you give them is not gonna go where it's supposed to go. They won't be able to digest it. But it has to be on a regular basis. And then, once you feed them, you have to help them get rid of the waste product. You have to stimulate urination and defecation. And that's gonna be your life for the next week or month to month and a half, okay? Warm environments are easy. You can get incubators, okay? Put some padding in there, make sure it stays at a constant temperature throughout. If that doesn't work, you can use other heat sources, like a hot water bottle, but what's the problem with this? It gets cold, and when it gets cold, what happens? Now it's a heat sink, and it pulls the body heat away from them, and they get colder. That's why I hate those warmy things, because nobody pays attention to them. They put them in there, and then they just sit there. How many people put warmies in yesterday? Did they take them back out and go warm them up again? Why are we doing that? Why do we let stupidity control possible outcomes? Because they don't check them again, and there's no way that those warmies are gonna stay at the right temperature, because they're just sitting on top, if they're sitting on top of the warming pad. So it's gonna get cold, now it's gonna start drawing temperature or heat away from the patient. That doesn't make any sense. So if somebody asks for a warmie, I hate that name, and then doesn't do anything with it, you guys should be doing something with it. Reach in and feel it. If it's cold, get rid of it.
We're allowed to do that?
Yeah.
Testing?
Tell the examiner, that warmie in there is cold. Should I take it out? Yeah, you should take it out, okay? And then if the candidate says, go warm it back up, now they're thinking. Does that make sense? So hot water bottles are good as long as they're monitored. Heating pads, if it's a Walgreens heating pad or whatever, you put it on the lowest setting you can get it on. Then you put it up one wall of their container and part way across the floor, so that they can crawl onto it when they want. If they're cold, they can crawl off if they get too hot, okay? You don't want to have a very fast variation of body heat. That can be damaging, so don't put them in the microwave. Feeding. If they're hypothermic, if the puppy or kitten is hypothermic, don't feed them yet. Warm them up slowly. The amount you give them depends on their response. If you feed them a little bit and all of a sudden they calm down, they go to sleep, they're probably fine. If they're gaining weight on what you're feeding them to the level we talked about earlier, they're probably fine. The food that you give them needs to be warmed. Don't give them cold formula. Don't give it to them out of the can or whatever. Warm it up until it's about 100 degrees, okay? Or close to body temperature. Once we get that done, then we can feed them with either a bottle that has a nipple on it, dosing syringes that have a little attachment to go into their mouth, or you do a feeding tube, okay? Nipple bottles are great. They're really easy unless they have air inside them. If there's air inside the bottle and the animal sucks in air, they're going to have that air inside of their GI tract, and that can cause colicky signs. Makes them uncomfortable. So get rid of all the air. Invert the bottle, squeeze it, get all the air out, and then turn it back over and let them nurse off of that. Okay? Don't squeeze the bottle. One of the biggest problems with nursing puppies and kittens is people get impatient. They're not drinking it fast enough, so I'm gonna squeeze the bottle. Make it go in faster, right? You know, it usually goes down into the lungs. No, nothing is chilled, you have to warm it up. You don't give it to puppies and kittens that are cold, so this goes not only for the food, but also for the patient you're giving it to. And they should have a strong sucking reflex. When you put the bottle in there, they should start sucking on it. If they don't do that, then you gotta figure another way to feed them. Dosing syringes work really well. A dosing syringe has a little attachment on the end. It goes into the mouth. When they start to get that in their mouth, you start to push the plunger on the syringe slowly. Because if you go too fast, it goes down in the lungs. Okay? And then it comes to feeding. When you're feeding puppies and kittens, you gotta have the right kind of a tube. Tube feeding, I mean. The length, you have to measure it. It has to be measured so it goes from the tip of the nose to the last rib. And then you mark the tube with a Sharpie or whatever you want, a piece of tape. Then you're gonna attach the tube to the syringe. No air is in the syringe. And then you have to push the feeding formula through the tube until you see it drip out here. Because otherwise, this is full of air. So you're gonna prime the feeding tube. It's gonna be warmed up to the proper temperature. Then you're gonna put the tube in. When you put the tube into a puppy or kitten, you want them to be in a relatively normal position. Put them kind of on their side, maybe with the head up just a little bit. Moisten the tube. One of the best things to moisten the tube with is the formula. Squirt a little bit out, let it run down the base of the tube again. Okay? You could put water on it. You could put sterile lube on it, but why? Doesn't matter. Then you're gonna open the mouth slowly, and then you're gonna start sliding the tube in. Can you guys see the larynx of the puppy or kitten? No? But if they have the ability to swallow, when you push it back to the pharynx, it should go into the esophagus. How do you know that? Because you insert it to that mark. If it doesn't go to the mark, you're probably in the lungs. Okay? Don't push it any further than the mark, because then it could get tied up if you're in the stomach. So you have to insert to the mark. If you're not going to the mark, you're probably in the trachea. Okay? Once you've got that done, you're going to inject that warm fluid slowly. Okay? You don't want it to push out the stomach too much and cause it to come back up because of the pressure. If you see the puppy or kitten start to regurgitate or the fluid comes out, you stop. Take the tube out and you don't feed them again until it's time again, the next feeding period. Okay? You want to make sure it didn't go into the lungs. Okay? So you just give them some time. And then you got to try to wean them off as fast as you can. Start introducing solid food so you're not going to be doing this every 3 to 4 hours. Even during nighttime, you have to give them up a little feed puppies and then try to go back to sleep. Okay? That's why it's so much easier to let a foster do it. Okay? Not a person, that means another cat or dog. Once you've fed them, now you have to stimulate elimination. You're going to take a moistened sponge or cotton ball or something and you're going to swab over the anal genital area. That stimulation is mimicking what mom does after they fed. And she does what? She licks them. And that means that they're urinating and defecating. Okay? And you have to do that until they're about 3 weeks old, which means you're going to be doing feeding and stimulating elimination for a long time. All right, well that gets us to foals. We'll stop there.
Show us that.